Hello, my name is Marta. I'm going to be your nurse for today. I understand that you were told that you may be at risk for what we called DVT, which is deep vein thrombosis. So my role here today is to help you understand what it means, what is it that you will have to watch out for, and how that we treat it. So DVT happens when a blood clot forms in your veins, and it is usually formed in the legs. These clots can be partial or complete, and they will block the blood flow. So in terms of if you do develop these, if a clot breaks, it can travel to your lungs. It can cause a pulmonary embolism, which it is very serious, and it can be very life-threatening. Some of the signs that you should watch out for would be swelling, either in one of the legs, which can happen suddenly or can be very persistent. It is not usually on both, so it will be either one or the other. If you have pain or tenderness in the area, it tends to be more towards like your calf area. If it is warm, like the area will feel warm. And if it is like discolored or it seems like red. If you happen to notice any of these symptoms, we ask that you let us know immediately. One intervention to help with DVT is to use early mobility. As soon as you're able to safely get out of bed, get out of the chair, move around, walk around, something to help keep the blood flow. That will help reduce the risk of clots. Sorry about that. Another intervention that we recommend is to use compression stockings. They usually squeeze your legs, and it helps improve circulation. It helps prevent the blood from just pooling in one spot, especially if you have to be on bed rest or if you have poor circulation and you're not able to get out of bed. Also, we have a few medications that we can give, which are known as blood thinners. We have our main used one, which is heparin. It is usually given either by IV or an injection. We have Coumadin, which is a pill that you take to use to help thin out your blood. And we have what we call Eliquis or Xarelto, which is pretty much the same concept that helps thin the blood and helps the blood keep circulating. They won't dissolve it, but it helps preventing them from getting bigger or from new ones to form. You will need regular monitoring. Your blood levels, especially if you're on Coumadin. And also, I'm going to let you know some of the signs and symptoms that you should watch out for to let us know. So if you develop chest pain, shortness of breath, if you have dizziness or if you're fainting, if you suddenly develop leg swelling or pain, if you cough enough blood, these are serious side effects, and you should let us call the office immediately. So as a little recap for today, DVT is a serious condition. Look for swelling, redness, warmth, leg pain on one leg, not two. Keep moving as much as you can, as safely as you can. Compression stockings, blood thinners, make sure you're taking them as directed, as prescribed, and not stop them. And, if you develop any other symptoms, call 911, call us, and just make sure that you're letting us know what's going on. If you have any questions or concerns, I'm here to answer any for you. Thank you.